In Good Shape, your weekly dose of health information on DWTV. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition and beauty. Medical professionals, therapists, and counselors are in our studio every week to offer their expert advice on In Good Shape.
And an expert on hearing loss and how to treat it is my guest in the studio today, Dr. mir-salim. Thank you very much for joining us.
Hello.
Dr. mir-salim, would you say from your experience in the clinic that there are more younger people suffering from hearing loss nowadays?
Of course, there are a lot of younger people suffering from hearing losses. We can see already the first signs of that if they have a high-frequency hearing loss. But the majority of the people are older people.
Mm-hmm. Older people because we are getting older, all of us as well, right?
Yeah, it's a normal process, the aging of the inner ear, the hair cells. So we see these problems, especially in these cases. It's no big thing that somebody getting 85 or 90 years old.
Mm-hmm. Hearing impairment or hearing loss is something that sort of sneaks up on you. How can you know if your hearing is impaired, if you've got a problem there?
So a typical situation is if you sit, for example, at a party or at a family event on a sofa talking to somebody, and if you're not able to understand him and you were able 2 or 3 years ago, then you have to think about that and let somebody check your hearing.
Mm-hmm. So watch these situations. If you have to have questions repeated or answers repeated, that might be a hint that you're losing your hearing or that there's some damage done there, right?
Yeah, this is exactly that situation. We call that cocktail party effect.
Mm-hmm. Okay, I remember that. To avoid noise-related hearing loss, how long and how loud can you listen to music via your headphones without causing damage?
This is already the most important thing. It's a question of the exposure time and of the sound pressure. So, for example, if you have a sound pressure above 85 or 90 dB over years, then you might have a damage of your hearing. Also, it's possible if you have a sound pressure about 140 or 150 dB, this is just like a starting airplane. This might be a problem after some seconds.
Mm-hmm. Well, it's difficult to establish, though, whether you know how many decibels the music has that you're listening to. How do you know? What rule of thumb can you give us?
A nice thing is to compare it with a diesel engine. If you're just standing beside, this is the border where you have to think about the loudness.
Mm-hmm. All right. Some headphones cause problems too. I've researched and read. Which ones would you recommend?
I think all these headphones are sitting very tight inside of the external auditory canal might be a bigger problem. All these types sitting outside of the ear are a less problem, a smaller problem.
So the outer ear earphones, because they leave the sound space away from your ears, basically,
yeah,
right?
Exactly. That is the thing. The pressure can just go between the earphone and the skin, and so this might be a smaller problem. If it's fitting too tight inside of the canal, the sound pressure is just going directly to the eardrum.
Noise is one reason for hearing loss. Dr. mir-salim, what are other reasons?
So we know genetic factors and diseases which can cause a hearing loss, and there are, of course, also inflammatory reasons for that. For example, in chronic inflammation of the middle ear or of damage of the ossicular system of the middle ear.
Mm-hmm. Some kinds of hearing loss are reversible and can be cured, and others are permanent. What's the difference there?
So permanent, for a permanent hearing loss is typical the age-related hearing loss. And if it's something which is coming up acute or by an inflammatory disease, there could be done a lot of things, especially these inflammatory things could be fixed microsurgically.
Mm-hmm. What is the best way to try and protect your hearing over the years?
If you have an acute problem, just close your ears or wearing earplugs if you know these situations before. Otherwise, you have to avoid loud noises above that, what I told you.
Mm-hmm. Is it worth giving your ears a break after you've been exposed to loud noises, like you've been to a concert, for example?
This is, of course, good if you do that. If you have a damage of your ear, if you feel not comfortable after that situation, you have to avoid loud noises. So this is the best way to treat it.
Hearing aids are very successful. Dr. mir-salim, what different options are there for hearing aids? What's being developed?
We know that there are three different types of hearing aids. The first type is a type which is sitting just behind the ear. and deleting the sound pressure with a small tube inside of the external ear canal. This is the most frequent use type. Then we have two other types sitting inside of the auricle or the external auditory canal. Especially these types are nearly invisible, but they, of course, are working in a different way.
I guess for many people it's also a cosmetic issue. You know, they might not want to wear a hearing aid because everyone can see it. What's new there? Is that something to worry about still?
I think this is not a big issue anymore because the hearing aids become smaller and smaller, so they are nowadays already nearly invisible. So this is no big problem in future.
What about implants? How do they work to combat hearing loss?
If the hearing aids are not enough for your ears, if your hearing loss is so severe that hearing aids can fit that, then we have the possibility to introduce an implant. These implants are called cochlear implants, and they are stimulating the auditory nerve directly. So this is a different way of hearing, but it's a very nice and proper way, especially for deaf-born children or for people who became deaf over the time, older people.
So you mentioned people that are born deaf. Does that mean these implants can make people hear that have never heard before?
Exactly, that is the thing. We have very small children, for example, 3 or 4 months, which were implanted, and they are learning 1 or 2 languages just in an absolutely perfect way.
Well, that's amazing. We've had a viewer who's interested in these things. Daniel Simon from New Zealand has written to us, and he wants to know what's new when it comes to hearing implants and hearing aids. What can we expect there in the future?
So we have a wide field of different implants at the moment to treat nearly every problem. I think in future we have the possibility and the chance to get a full implantable hearing device for the electric stimulation, and I think also that all these kind of conventional hearing aids will be developed in future to get smaller and smaller, and the filter techniques will just get better.
It's important to prevent the problem in the first place, though. We've had someone else writing to us, Marina Schwift from Argentina. She wanted to know which medications can cause loss of hearing.
Yeah, this is a very important question because the medication can already have a very big influence if you take the right and the adequate one. So we know some antibiotics are working and having a bad influence, gentamicin, for example, onto the hearing. And we know also that there are some malaria medications having influence on that. And also, in some cases, aspirin, but only in a very, very high dosage.
And if you suffer from hearing impairment, there are effective therapies that can help you, right?
Yeah.
Well, thank you very much for being our guest today. Thanks for taking the time.
Thank you.